Freehand microvascular venous anastomosis. When the usual double approximating clamp or Acland double clamp cannot be applied because the recipient vessel or pedicle length is too short, it's called freehand microvascular anastomosis. It can be of two types. Either a single clamp technique used when one vessel end is controlled with a single microvascular clamp, but the two vessel ends are not held together in a double approximator clamp. This is often used when only a short length of vessel is available. Single clamp require less dissected vessel length than double clamps. The second type is clampless or unclamped anastomosis. It's a less common term used when the vessel is controlled by the vessel loops, temporary clips or assistant traction or proximal control rather than a formal double clamp. This video demonstrates a freehand microvascular venous anastomosis in a case of scapula flap. We are not going to the details of flap. The first step is the first bite on one end on the patient side vein. Here we see the first bite from inside out taken from the flap vein. And this is the first note. After the first note is done, the next thing to do is approximate the posterior wall rather than the anterior wall. Now we can see the first note on the posterior wall with a reverse bite, outside in. On the patient vein. After that, we take an inside to out bite on the flap vein posterior wall. And this knot is close to the first knot. Here you can see the knot is being completed. After the first note, a series of interrupted posterior wall notes are done to approximate the posterior wall. This is the posterior wall, second knot. Again, starting from the patient vein, reverse bite outside to in, and then on the flap side from inside to out. Here the second knot is being completed. See how the reverse hold is done with the needle holder. And a similar third posterior wall knot is being done. The assistant is here helping to open up the vein wall to expose the inside of the posterior wall of the flap vein. The third and the final posterior wall knot is being completed. And then the attention is turned to the anterior wall. Here again, the first anterior wall knot is applied close to the initial first knot, starting from the patient side vein outside to in, and then on the flap vein inside to out. Make sure no posterior wall bite is taken inadvertently. that completes the first anterior wall node. More similar anterior nodes are applied to completely approximate the anterior wall. Multiple stitches may be required. This is an unedited video, hence you are visualizing each step and bite of the anastomosis. One end of the thread may be left a little long so that the assistant can hold on to it and pull on it to expose the vessel wall and edges as it is being done here. And the surgeon is giving a counter traction. Sometimes copious irrigation can also help to separate the venous walls, helping to take the bites without a bite on the back wall. This case also had an incidental peculiarity in that The flap vein, as you see, was a twin vein or two veins approximating to a single vein, and the cut edge of the vein was immediately adjacent to the point where the two veins were joining to form a common vein. You'll see that more clearly when we release this single clamp to see the flow. You can see the assistant applying some amount of traction to expose the edges. That is the last stitch being taken. That's the end of the anastomosis. You can see there is only a single clamp and no double clamp was applied. And that single clamp is now being released. Now you can see the anastomosis, and as I said before, you can see that twin vein on the flap side and single vein on the patient side. And the venous flow towards the patient side is being checked with the help of two Joella forceps, and the flap is checked with a needle prick test to confirm that the anastomosis is working well. Thank you.